Here are 5 things I think you'll wish you knew before you see a doctor. Now, I practiced medicine, cardiology, for 25 years and had many years of training, so I spent a lot of years in the healthcare system, and I've seen the good and the bad in a variety of different settings. I can tell you that healthcare of just 30 years ago, 40 years ago, was very different than it is today. Go back 50 or 60 years, healthcare was delivered by a doctor who's often local, who probably delivered you at birth, may have even delivered your mom or dad, knew your family, knew where you lived. In other words, there was a long-term relationship. You know, when you have a long-term relationship with somebody, you tend to care about them more, about their safety and their welfare. In modern healthcare, all that's gone. The modern healthcare interaction now is a brief, transient, impersonal interaction, so it's very difficult, perhaps impossible, for the doctor and other healthcare personnel to really care that much about you. If they'll see you once or a few times, never see you again, it's really hard to be involved in that person's life and take a real interest in their safety. So modern healthcare has become all about money and the bottom line. Healthcare is a business transaction, and the business transaction is weighted towards benefit of the doctor and the healthcare system. Did you know? So here are 5 things you need to know before you enter the healthcare system and put yourself potentially in jeopardy. 1. Most doctors are now employees of their healthcare systems. That wasn't true 50 years ago. Most doctors were independent or part of a group or a small group or a large group. Now they tend to work for large healthcare systems. They're salaried, but they're also incentivized. They're told things like this: doctor, the more revenue you raise for the healthcare system, the larger your end of quarter bonus. So the more MRIs, CAT scans, neurology consultations, electrophysiologic studies, cardiac catheterizations, exploratory laparotomies, laparoscopic knee surgery, etc. The more revenues the doctor generates by referrals or performing them himself, the larger his end of quarter bonus. That bonus could be substantial. It's not like a few dollars. It's going to be $25,000, $50,000 or more. It's substantial. So it's very, very motivating to doctors to churn people for procedures and then be rewarded for it. Another thing you should know is because of the pace of change that we have such a flood of information coming at us, but most doctors are not up to date. They might be up to date in their little narrow area of expertise, but they tend not to be up to date in many of the other issues outside their main area of focus. And even many doctors are not even up to date in that. So if you go to your, let's say, neurologist, and you've got Parkinson's disease, and you read that the microbiome, the intestinal microbiome, is likely a major player in Parkinson's disease, both H. pylori and SIBO, and perhaps SIFO, small intestinal bacterial overgrowth, small intestinal fungal overgrowth. These are fairly new issues. The science is overwhelming, supporting the fact that the microbiome plays a role in neurodegenerative disorders. You go to your neurologist, and he's going to say, What? I don't know. That's ridiculous. Don't waste my time. Did you consult Dr. Google or something like that? You're going to find this over and over and over again, that the doctor was trained in medical school, then training. That may have been 15, 20, 25 years ago, and the effort at continuing education is really kind of meager. And so you're going to find that the newest science is not appreciated by the practicing physician. So be aware that if you take an interest in a condition, a situation, a healthcare issue, you may be far better informed than the doctor. And you know what? It's not your job to educate the doctor, because if the doctor didn't educate him or herself, they're not going to do it for you. So you're better off finding a doctor who has taken the trouble to educate him or herself and is up to date on the issues you're concerned about. 3. Recognize that doctors are terribly guilty of something called willful ignorance, and that is they pay attention to the things that they're interested in, particularly things that pay better, and are purposefully ignorant or don't pay much attention to the things that don't pay better. So, which is more interesting? A coronary artery bypass graft surgery that pays many thousands of dollars to the doctor and about $100,000 to the hospital? Or vitamin D that costs you a few dollars a year but has spectacular health benefits? Guess which one the doctor will be an expert in? More in the procedure than in the nutrient. How about nutrition? How many doctors have you run into are experts in nutrition, know about things like glycation and carbohydrate content and ketosis and microbiome consequences of diet. It's very difficult to find someone like that. Doctors should be, in an ideal world, experts in nutrition, but they're not. And it's not because they're stupid, it's because they're willfully ignorant of things that don't pay. Activities, information, procedures that don't pay them well. Another thing you should know about is when you're told, ask your doctor about this supplement and whether it's safe for you. A common question is, can you take fish oil if you're going to have surgery or if you're taking other drugs? And doctors will say, stop the fish oil, it's stupid, it's going to make you bleed. What they're saying is, I don't know a damn thing about fish oil. I haven't read any of the science. I might have read a little passing paragraph in a throwaway newspaper or a magazine, or maybe I talked to one of my colleagues in primary care about it, but I really don't know anything about it, so I'm just going to tell you you're stupid and you should stop it. That is absolutely true. I've seen this happen time after time. To be honest, I purposely quiz my colleagues now and then to see how much they know, and it is incredibly easy to embarrass them. They do not know very much at all about nutritional supplements. Then why are you told? If you want to know how to manage vitamin D, talk to your doctor. If you want to know if fish oil, omega-3 fatty acids are safe with aspirin or Plavix, a blood thinner, ask your doctor. Or ask your doctor if ashwagandha or turmeric is safe for you. They don't know. They have no, with some exceptions, of course, but the vast majority of mainstream doctors will have no idea. That doesn't stop them from authoritatively telling you, stop it, don't take it, it's dangerous, it's stupid, supplements don't work, all those things they say, not because of confidence and knowledge and insight into science, but because of ignorance and wanting to maintain face, to be honest. Another thing you should know about, the more specialized the doctor, the less likely it is you obtain information that really gets to the bottom of things. So, for instance, if you're seeing a neurologist for Lou Gehrig's disease, and a lot of the cause is an underlying severe dysbiosis, disruption of the microbiome, and other factors. He's just going to try to give you some drugs that maybe reduce some of the symptoms. He won't address the actual causes, one of which might be massive disruption of the microbiome, SIBO, SIFO, and related conditions. So, in other words, he'll give you essentially Band-Aids, never address the cause. Diabetes, another excellent common example. You'll be given, if your blood sugar's high, like maybe fasting blood sugar is 150 and your hemoglobin A1C is 6.9 in the diabetic range, your doctor will then send you to a diabetic educator who counsels you on cutting your fat, eating more healthy whole grains that raises blood sugar and causes weight gain. Okay? And then the doctor prescribes metformin, Byetta injections, and then insulin, NPH and short-acting or something like that. The insulin, by the way, causes extravagant weight gain because insulin is the hormone of weight gain and fat deposition. And so it defeats the whole purpose. And you're no better off. You're still going to be subject to kidney failure, peripheral neuropathy, heart disease, acceleration of dementia, and 8 years shaved off your lifespan, regardless of whether you're on the drugs or not. What if you instead correct the underlying causes of type 2 diabetes, consuming foods that raise blood sugar and insulin, and correcting the common nutrient deficiencies in modern people that contribute to insulin resistance, the process that allows diabetes to emerge. Vitamin D, magnesium, omega-3 fatty acids, iodine, and efforts to cultivate a healthy microbiome. And then blood sugar and insulin resistance drops, blood sugar. Do you see what I'm getting at? You may see the best diabetologist or endocrinologist in your city or in your region, and he's just going to be real good at prescribing drugs that push your blood sugar down, but do nothing for the underlying conditions that allowed diabetes to emerge in the first place. So it's become your job to address these kinds of things because the doctor won't do it. The healthcare system won't do it because there's no money to be made and because they're not interested in addressing the cause. That's what we do in my Wheat Belly and Undoctored programs. We show you how to not have these conditions, not by treating them, but by correcting the factors that allow them to emerge in the first place. If you want the best summation of this entire program, I've just released another book. It's called the Revised and Expanded Wheat Belly, and it takes all the information, conversations, and advice from about 7 or 8 books, and I've combined them down to this one, the Revised and Expanded Wheat Belly. And it's a good place to start if you want to engage in this program. You can also, of course, subscribe to my YouTube channel where I talk about a lot of these things, or also take a look at my Wheat Belly blog, a very busy place, my Undoctored blog. And people who really want to dive deeply into health issues and want support and guidance to do that, consider joining my Undoctored Inner Circle, where we even have 2-way video meetings, group meetings, at least once a week to talk about these kinds of issues.